So when I first got to Watsonville, I, of course, had to start building my practice, and I got a message from a spine surgeon in the Bay Area who I had worked with before. He is a world-famous spine surgeon, trained a lot of spine surgeons. He is quite a well-known individual, and he sent me a message, actually called me and said, hey, there's somebody down there that I think I'm going to send to see you. They need some spine surgery. So a few weeks later, this person comes into my office and we're sitting here talking, and I'm looking at her x-rays and I'm thinking, wow, this person, whoever did this surgery 20 years ago, 25 years ago, this is pretty impressive for a spine surgery that was done 25 years ago. It's perfectly aligned, it's great. But the issue was that the person had a problem above where the original surgeries had been done. So I go in to see this patient and we sit down, we're chatting for a bit, and this patient reveals to me that this is the patient that this spine surgeon had sent to see me. Turns out she's also the wife of a now retired orthopedic surgeon from the Watsonville community who had been in practice for almost 40 years, a well-respected guy. And so, no pressure. So she had, she'd had 2 previous spine surgeries, had a difficult time going through this, post-surgery because of pain issues, but she did well for a long time afterward. But she was now really having a difficult time because she was having pain, couldn't do things she likes to do. She rides horses, likes to hike, very active individual. And she said she would love to be able to get back to doing what she could do, hiking, riding horses, traveling, but she couldn't do it in the pain she was in. I told her that I think the reason that this professor, this surgeon in the Bay Area sent her to me, instead of having her go to Stanford or UCSF or places like that, is he knew that I could do minimally invasive surgeries. Minimally invasive surgery is where you do the same surgeries, you just do it through smaller incisions, and you get the same outcomes or sometimes even better because less pain afterwards, less tissue damage. Similar to the way gallbladders used to be taken out with open surgeries, and now everything's done laparoscopically. So in spine surgery, there's been kind of a delay in getting there, but it's now becoming much more common. But more people are doing it, I should say. But we're able to do surgeries through smaller incisions. So she was, of course, a little hesitant about surgery, and I told her, take your time. Whenever you're ready, we'll take care of this for you. And so we did her surgery. Small incision about this big, about an inch. And I was able to fuse that level of her spine. It took a couple of hours to do the surgery. And she went home the next day. And she is now back to doing the things she loves to do. She's gardening, she's hiking. I'm not sure if she's got back on the horses yet, but the last time I saw her, she said that it's the first time she's been pain-free in 10 years. So that was a successful surgery in that helped the patient, but it was also successful in that I came into community and I was operating on somebody where everybody was going to know if I did the right thing or not. So fortunately, it all worked out and she's doing great.